The content within the Med Surg Moments podcast represents the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses. This is Caroline,
Parker,
Mary Tess,
Neil,
and this is Laura. Welcome to Med Surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud Med Surg nurses, just like you, sharing our stories, insights, and experiences to support you in your nursing journey.
Our topic today is managing patients with Alzheimer's disease. But before we get started, let's see what's new with everyone. Neil, why don't you start?
Hey guys, it's good to be back. I did get accepted to University of North Carolina at Wilmington for their MSN in education. I'm currently still waiting to hear from Duke University. I'd need to first get an interview with them and then their acceptance. I am also in the process of interviewing for, or actually tomorrow I'm going to go shadow for a PRN position in radiology oncology I was recommended for by a coworker of mine. So always an interest in me in oncology. One of the things I love about nursing, besides the vast field of med surg nursing, is all the different variables and fields that you get into it. Always loved oncology. So doing radiation treatments would be a nice little skill set to add on top of all the other things I've been doing throughout the years of nursing. So looking forward to that shadowing experience tomorrow. Actually, the exciting news, totally almost forgot about that. I was actually nominated for a Daisy Award.
Wow, that's huge.
Right?
Great news.
That's huge. I kind of laugh. I used to be at my old job, at my old hospital system for 13 years, never got nominated. And within the first 9 months of starting at a new place, nominated for a Daisy Award. So I was exciting. I didn't win it actually, but you get your little button and you something to put in your resume. You got nominated. That patient took enough time to fill out paperwork to say that you did something special. So that was really moving. Brought me to tears hearing about it. I kind of thought it was like one of those spam emails at first, but sure enough.
That's what it's all about, Neil. Congrats.
Congratulations.
Thank you.
That's great. That's
right
wonderful.
Next to getting my lamp and probably getting my MSN, that's going to be up there in those accolades of things done. What's going on with you, Parker?
Hey guys, it's been a minute for me too. I've been a little MIA lately. Still working as a trauma nurse on a Med Surg tele trauma unit. Work is going great. Crazy enough, Neil, I also was nominated for a Daisy Award.
Wow.
Congrats.
Amazing.
Yeah, it'll be my second nomination. So,
wow, rock star.
That's been going great. Still at Duke for my acute care NP. In some more personal news, I scored some VIP tickets to go see Beyonce in Los Angeles. So
wow,
you got them. Excellent.
Yeah,
that's amazing.
It was we just got them like a couple of hours ago. So I've never seen her in concert, so I'm totally stoked. And I got the VIP tickets, so we'll be like right by the stage, which I'm super excited and happy about.
I'll warn you, Parker. I went to the Jay-Z Beyonce On the Run 2 concert and had somewhat VIP tickets. I had a sore neck the next day from looking up because you're so close.
Yeah.
I don't know if you want to pre-medicate with some Tylenol or I enjoyed it, but definitely was hurting the next day.
Yeah, I'm super excited. I actually just left LA in January to go visit some family members out in LA. And before I left, I was so impressed with the hotel we stayed at that I unknowingly booked the same hotel from August the 24th to September 4th. And then her ticket packages came out for LA and it happened to be September, I think the 2nd or 3rd. So unknowingly, I already have a hotel. So I was super stoked about that.
It's meant to be.
Yeah, exactly. Perfect timing.
Let's just hope she doesn't keep you waiting too long. I read today she was 30 minutes late for the Grammy. She wasn't even there for the first 2 awards that she won, apparently.
It's Beyonce. She can be as late as she wants.
I was going to say, I suppose that's her prerogative. Yes. Yeah.
I'll wait. I'll wait.
You'll wait for her.
Beyonce.
That's funny.
Yeah. All right, Laura, what's been going on with you?
Oh, for me here in Texas, we are recovering from a freeze that we had last week. The entire city just about shut down.
But I'm just glad that all of our pipes stayed intact this time. Last time we had a bit of a flood in our house with the last storm. So we're doing okay with that. Work is going well. We are in the middle of developing ongoing competencies. That's a fun word for you educators out there. So we're just kind of getting our hands wrapped around that next project. But other than that, everything is good. Caroline, anything new with you?
Well, I'm fighting the dog. We've bribed him with treats. We'll see how that works. What's going on with me? Work is just sailing along right now. Not to one up anyone, but I was actually the recipient of the first Nurse Leader Daisy Award at my facility.
Wow.
Several years ago now.
Look at all of us here, just, a bouquet of flowers.
And so really the only reason I mention that is because it's such a worthy cause. And for any hospitals out there that don't know what the Daisy Award is now, you really need to find out and get it on board in your facilities. I had the pleasure of meeting Patrick Barnes' wife and his parents, and that's where all this came from after they lost Patrick so quickly to idiopathic thrombocytopenia. And just an organization that's just grown and grown. There was the Daisy Award, then they introduced Nurse Leader. I understand now they're introducing a Daisy Award for research. So I'm the proud owner of one of the Healer's Touch statues, and they really are very unique and very special. So congratulations for your nomination. Mary Tess, what about you? Anything exciting in your neck of the woods?
For me, it's very exciting at work because I will share with you, with our team, we're constantly growing and we have like a bunch of educators starting soon. So that's very exciting. But I think the more exciting part is my mom-in-law is having her birthday soon. I know she is not listening to any of the podcasts. The kids are preparing for her birthday. So it's not me and my husband doing all the preparations, but it's really the kids. And it really excites me a lot because having them planning all the things and making the cards and the gifts and the arrangements, it kind of give me hope, someday in the future when I get my grandchildren, probably they will also teach them, how to plan for my birthday or special occasions. So why don't we move on to our topic? And today's topic is one I suggested, managing patients with Alzheimer's disease. And since it's my topic, I thought I'd start with a little background as to why I chose this topic. This actually started when I was discussing with one of the new nurses in our hospital, in one of our hospitals. She said that I'm taking care of an Alzheimer's patient and I don't think I'm ready for this. That was really concerning on my end that she said that because in the hospital that I work in, our demographics is patients who are 82 years old and above. So if she is concerned that she is not able to take care of Alzheimer's patients, what's going to happen with her day to day? She's going to live with challenges and anxiety. And so I sat down with her and I said, I'm really very concerned. Let me know exactly what you mean by this is not what I'm expecting to do. And she did list down the things that she's concerned about. The day-to-day that she is afraid that this patient's going to fall, that at some point she wanted to ask the physician to order a restraint. And she would say and tell herself, I am snapping on this patient. And I said, let's talk about that and let's sit down. So I wanted to hear from you guys, what are the tips, tricks, knowledge that we can share to our colleagues regarding how we can manage patients with Alzheimer's disease?
There's so many things I can say about this topic. I think the first thing that I'll start off with is that just as Med Surg nursing is a specialty, so is gerontological nursing. And I think a lot of people forget that. I think a lot of people try to group caring for older patients under the same umbrella as Med Surg nursing, which is just regular nursing, in quotes. It's what we get often when we tell people that we're Med Surg nurses. So I think one of the first things that we can do to tackle this issue, caring for patients with Alzheimer's disease and just aging populations in general, is education. Learning to manage these patients, especially with agitation. There are wonderful drugs out there that we can use to medicate our patients appropriately. And I really think that's missed out on, especially in the hospital setting. I come across a lot of doctors who don't want to medicate these patients for their agitation because they think it'll contribute even more to, let's say, if they're experiencing acute ultramental status or acute encephalopathy or something like that. But, it really does make it all the more difficult for the staff, but most importantly, the patient to have a good hospital experience. So I think education really is one of the ways that we can tackle that. I'm gerontological certified along with my CMSRN as well. And it really has helped me to kind of just learn how to care for these patients. And I think another thing that could be really helpful is starting the end of life care topic early, kind of making a goal of care plan early, because unfortunately with Alzheimer's, there's no cure. We know where this is going. We know that the patient is starting to decline. And, sometimes it can often happen rapidly. So I think identifying if our patient is just experiencing acute agitation, or are they steering towards end of life agitation and we need to have a goal of care meeting. So I really think education is the key to making sure that these nurses are prepared to care for these patients. It is so difficult. I am sympathetic to her snapping on the patient and stuff like that, because it does take so much patience and lots of repetition. But I think if we start educating people to prepare and plan for that and ways they can combat that, that would be a good thing. You don't have to lie to your Alzheimer's patient, but you can certainly do things to placate them. If they're saying, oh, when am I going home? Or, stuff like that. Just say, hey, I have your medications. Would you also like some ice cream? Things like that.
Those are great points, Parker. One thing I want to bring up is that we need to also engage family members in these conversations. Sometimes there's things that family members use at home when these patients act like that. I know we used to give some of our patients laundry to fold, like give them a whole bunch of towels. So it gave them a task. It gave them something to do. Always those old standbys where you move them closer to the nurse's station. Or if they're stable enough, you can put them in a wheelchair and bring them out to the nurse's station. It's always better to have maybe a sitter at the bedside or a family at the bedside because, restraints and medications are not always the first line of defense with these patients. We've got to try to work with them and do what we can to try to reduce some of those behaviors, because I can understand why your nurse was scared, because these patients can be a challenge. Sometimes it's hard.
You had mentioned something. A lot of doctors are very reluctant to start prescribing some heavy duty medicines to help with some of that behavior, and rightfully so, between kidney function and interactions with other medications they may be on for mental issues. Most recently, I've been helping my aunt kind of go through some of the same thing with my married-in uncle's sister. And so it's kind of this tough part because there's end of life talk. And so where does that come into play? And legally, who has the responsibility of saying what to start that kind of conversation, let alone the decisions being made, is also a big thing I find all throughout the time I've worked Med Surg. And when I used to work psych on the geriatric Alzheimer's unit, is a tough conversation to bring up. There's a fine line between working a Med Surg, I believe here they call it the niche market there, where it's in care health of elderly, as opposed to a true geriatric Alzheimer's memory care unit. And that is a subspecialty of that. Sometimes it's keeping them busy. I do night shift. Hey, what kind of shift work did he or she used to do? A lot of times, a lot of the older guys did shift work on that second shift. And so that's why they're up all night. So give them something to do.
Yeah, I think all of your comments and input so far is really valuable. The sadness with Alzheimer's is that it leads its way to a slow, progressive death. And so I think it's very important that we've mentioned end-of-life issues for our med surg nurses out there that may not have experienced someone with Alzheimer's disease. We really don't understand the trigger factors, and we're taught throughout our life to be physically healthy, emotionally healthy, but we never get to really look at these brains until these people have passed away, of course. And right now, there's no medications that can really help. But one of the things to consider is safety. And, safety sounds a little lame perhaps, but these patients, of course, as the disease becomes progressive, this is when these patients start to wonder. This is where these patients forget they put a pot of hot water on the stove. This is where they forget to blow out the candle, for example. I had a patient who lost her entire home because she had candles burning throughout the house, and the house went up in flames. And she was admitted with severe burns. And while everyone was focusing on the burns, it took everyone a minute to realize that the trigger factor was the fact that she had well-developed Alzheimer's disease. So I think, Neil, you were the one that just mentioned sitters or family. Definitely routine is very important to someone with Alzheimer's. And then they have these moments where family members will fill the room with familiar items, pictures, or little trinkets or whatever. But even that can kind of throw a curveball, and the patients very alarmingly can be looking at pictures saying, who is this person? I don't know this person. Why is this picture in my room? Or even when a family member arrives, who are you? Get out, get out. You're trying to hurt me. It's just heartbreaking to see this. And in a world where we're used to fixing our patients and sending them on their way, Alzheimer's is a very hard one to deal with because of the degree of dementia that's going on with the brain. Statistically speaking, 50 million people worldwide suffer with this. So this is widespread, and it's time that we really look to the research and see what's going on, to see what hope we have, if not to cure it, but to at least minimize the symptoms or to be able to manage the symptoms with a little more predictability.
Caroline, you make a great point. We've gotten so short on sitters that we actually have tele-sitters that are basically cameras in the rooms. And I'm anti-that for when it comes to Alzheimer's dementia, like I said, because all of a sudden it's like there's a voice in the room. I'm hearing something, and it even causes more confusion.
Got to think about what else might be going on. We were talking about trying to identify triggers. Well, sometimes these patients might be hungry or they might be cold. That can be very sensitive. So sometimes if you bring them a warm blanket, that can kind of get them snuggled in, or maybe bring them a snack. They might not know to verbalize that they have those needs, but if you've tried everything else, that's always something to think about. The other thing that I wanted to point out is, I think Parker mentioned that sometimes Med Surg kind of gets everything that's not critical care. So we can lump all of these patients together. And sometimes we have patients that might seem like they have dementia or Alzheimer's, but really they've got an infection. So we've got to be paying attention to other things that might be causing those symptoms. But managing those symptoms is the same in an Alzheimer's patient as it is in somebody that has an infection like that. So all of these tips and tricks that we're talking about might not just apply to patients with Alzheimer's on a Med Surg unit.
Yeah, absolutely, Laura. There's nothing better than a good urinary tract infection to cause altered mental status and different degrees of that. So always a very valid point when you're assessing your patients to detect any underlying infection by clinical presentation. And of course, looking at lab values, white blood count going up, and fever, and a low-grade fever. And of course, that urine can be all telling sometimes. Yeah, that's a really good point, definitely.
Interesting that you share that, Laura. And thank you, Caroline, for adding up the information, because the patient that the new nurse had came in with symptoms of confusion. So the family members thought that this patient is just having an episode of cognitive problems, but the patient had an infection, a urinary tract infection, and came in looking at all the assessment, the patient was septic. So thank you for bringing that up. That's really a very good point. I really appreciate that. Also, I wanted to really add into keeping the patients busy. I heard everybody sharing that the towels, other diversional activities that we probably can share. I think those are really very important. As nurses, we need to be creative. I remember when I was at the bedside, what I do is get all these towels. Once they're folded, I throw it away on the floor. Oops, look, we need to fold more towels. And so it's a fun activity for our patients. I like what you said about making sure that the patient is safe. Caroline, you're right. It may be so simple, but that's basically what we need to do for our patients with Alzheimer's, making sure that nothing is hanging on their bed, or they're not going to fall, or if they're going to fall, somebody is there. Neil mentioned about tele-sitters, and I do agree with you that the voice sometimes that they hear is scaring them more than comforting them. I remember one of our sitters was talking to a patient and said, "Don't move," with a low tone of voice. Absolutely. And this patient just started like jumping out of bed. So a lot of pointers there, but like you guys mentioned, safety. That's really very important. Make sure our patients are safe.
At the hospital I'm currently traveling at, the cameras are actually right above the TV, so kind of where you can't see them. And the sitters, the people who monitor those cameras, don't have the ability to speak into the room. They'll just send an alert to your phone when your patient's attempting to get up. I think that's probably a better way to use the cameras, not yelling into the room. Not that our impaired hearing, older folks wouldn't hear it anyways, right? But one thing that I do know is that a lot of our younger patients, because we have the wide screens now and they have Apple Play where they can stream shows and all that stuff across the TV, it really hurts my heart because our older patients don't have the technological capabilities for that, where our younger patients are streaming all sorts of things like Netflix, video games, or FaceTiming with their friends across the TV, but our older patients don't. One thing I do like to do is just pull up Pandora and play their favorite music. That often will help to calm our patients. I remember I had one patient at my second travel nurse assignment. I had like a smooth jazz playlist that I would bring up on YouTube, and I would play that gently in the background. Lower the lights. They had warm lights in there, which was really cool. Turn on the warm lights and she would go right to sleep, which was great. But having that little bit of music or a little background noise was comforting and relaxing to her. I know my grandmother, she never had Alzheimer's or anything like that, but she used to like watching old sermons on YouTube. There's a plethora of things that you can find on YouTube that the patient possibly could like, and having a family member coming in and bring it, or even pulling up YouTube on the patient's computer while you're not in there so they can at least look at something. So those are just other tips and tricks that I've used before.
What a really important point there that made me think of a patient just recently who had very well progressed dementia. She had no family or support system, but all she wanted to do was be with Jesus every morning. Let me be with Jesus. Let me be with Jesus. And we're thinking that she's wanting to pass away, but all she wanted was the religious channels where she could hear music, listen to the gospel being preached. And that was about the only thing that kind of kept her on the straight and narrow and helped us take care of her, because otherwise it was just a fight. She didn't want to bathe. She didn't want to eat. She didn't want to take care of herself. But if we could get her to focus on this TV show, it was very, very therapeutic for her, because these patients can also become very feisty and combative. They're terrified, of what's going on. So
you just got to find the right key.
Yeah, exactly. This is it. This is exactly it. And when these patients do have family members, they tend to drop the patient off and disappear. And one line of conversation is, oh, that family's terrible. They just abandoned this poor lady or this gentleman. But they're exhausted too. They are worn out physically and emotionally as well. And we always have to remember the family, the caregivers, because someone said to me once, is this going to happen to me? This is my mom here. She was a wonderful, feisty lady. We did so many things together, and look at it now. Is this going to happen to me? And, depending on what you're reading, most literature says that it's not an inherited disease, but you can't help but sit there when you're looking at your parents thinking, my goodness, is this what I've got coming? How can I stop this from happening? So you've got increased anxiety there, one from the family member because of their loved one, and two, what's going to happen when this happens to me? And we really don't have any evidence to say it won't happen. So very complex disease with a lot of issues to consider. And in the med surg setting, that tends to be a very small piece of the puzzle. They come in with a urinary tract infection or pneumonia, or they've fallen and broken a bone, and they just happen to have Alzheimer's. And we have to consider that sometimes a little bit more than we perhaps do, rather than putting these patients in restraints and trying to completely minimize any skill or function that they have left.
I remember one night when I was still floating, I was on a behavioral health unit, and this little lady was partially blind, partially deaf, and she was convinced she had to sit at the bus station there, which just happened to be a little table set up in front of the nurse's station, and she was waiting for the bus to come. I gave her everything she could for sleep. I gave her some Vistaril to help relax her, a lot of non-narcotic stuff. And she was just bent on getting out of the bed all the time. And it was such a scary situation because She was partially blind and had troubles ambulating. And so, you know what? I just sat her in front of the nurse's station, set her up a bunch of snacks and said, I'll sit here gladly and wait with you till the morning, until that bus comes to get you to go back into the city. And sometimes you just write it out with them and let them believe it and don't disturb them of it.
Another thing is to get the assistance of the other staff members on your unit. Just let them know this patient is kind of a challenging patient. If you happen to be walking by, can you poke your head in? Just get everybody to help you with that patient.
Thank you for sharing that, because and also when you pop your head, I think the attitude and the behavior of the nurse and the team members coming into the room is also very important. Because I think as we say hi and hello to our patients with Alzheimer's, and you're not in the right demeanor, or you're probably aggressive yourself, what happens is it escalates the situation. So I think that's really very important too. So thank you for sharing that. I've had experiences like that. The patient was calm and okay, and the patient suddenly became so aggressive for some reasons, and it's because the other team member was too loud or saying something that's not within what she understood, what the patient understood. And so very important to be very cognizant of our own behaviors when dealing with patients with Alzheimer's.
Even our tone and pitch.
Yeah, good point there, Marites. It takes the patience of a saint sometimes to manage these patients, especially when they are having really bad days or nights and are very combative and difficult to manage. It's not the actual disease that becomes the patient's demise. They develop pneumonia because they won't get up and out of bed and walk, or they can't follow instructions when you ask them to take deep breaths. If they've been to surgery and trying to use intensive spirometry, they won't drink. This little lady I was just talking about just wouldn't drink. You can get away with not eating for a while, but you've got to get fluids on board. And we ended up starting with regular IV fluids, switching this lady to TPN, and she was just declining every single day. And very sad story. She had no family support whatsoever. And so right before Christmas of last year, she coded and we got her back. She was full code. Nothing to this poor little lady. Anyway, bottom line here is the basic food, nutrition, and keeping the patient within that comfort zone can certainly help manage these patients. When it gets to the end, unfortunately, it's not the Alzheimer's, it's the pneumonia or the sepsis that they got from a pressure ulcer because they wouldn't get up and walk. And very, very difficult, very sad disease for sure. So my only piece of advice to people who are getting comfortable with taking care of patients with Alzheimer's is do your research and try any tactic out there that might work 1 minute and not work the next. But those resources are what you need to help take care of these patients effectively, for sure.
Yes, and go in with that mindset. Just go in with the knowledge that you might have to try more than one thing. Because if you're on edge to start with, you're going to get frustrated very, very easily. So if you start with the mindset that what I try may not work and I have to be flexible to try something else.
Yeah. I think that's a really good point.
Definitely. And I also would say lean on your more experienced nurses. Don't be afraid to tap into your charge nurse, your nursing supervisor, your resource nurse, whoever you need. Nursing is a team building activity. So tap into those resources. New nurses can be afraid to ask for help, but if I'm not getting what I need, then the patient's not getting what they need. So always be willing to ask for help, and then also be willing to lend support to your colleagues as well.
Well, we're just about out of time. But before we go, let's quickly summarize what we've learned. We must seek education on how to best manage this unique patient's population, engage family members in the conversation, start the end-of-life conversations early, keep the patient busy, give them simple tasks that they can do, such as folding towels, make sure the patient is safe, nothing hanging off the bed, and eliminate fall hazards, identify triggers in the patient, play the patient their favorite music in the background, notify other staff members about the Alzheimer's patient and ask them to help you keep an eye on the patient. Trial and error is key. And of course, tap into your senior nurses. Thanks for joining us. We'll see you next time.
We look forward to connecting with you on the next episode of Med Surg Moments, the AMSN podcast. In the meantime, we want to hear from you. Send us your questions, topic ideas, and feedback via our official Med Surg Moments email address, amsnpod@amsn.org. That's amsnpod@amsn.org. I'd also like to remind you to become a member of AMSN or renew your membership at www.amsn.org. You receive lots of cool benefits and perks, such as discounted pricing on the annual convention and continuing education.
We encourage you to help us spread the word and subscribe to the Med Surg Moments podcast via your smartphone podcast app to receive notifications of future episodes. Please be sure to leave us a review and recommend Med Surg Moments wherever you get your podcasts to help us reach even more listeners.
I invite you to join the conversation by sharing your ideas and questions on AMSN's Facebook, Instagram, LinkedIn, or Twitter pages. And don't forget to add hashtag MedSurgMoments to your post. Simply enter AMSN in the search field on any of these social media platforms to connect with us.
The content within the Med Surg Moments podcast represents the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses. Until next time, I'm Caroline,
Laura,
Parker,
Neil.
And this is Meritus. And always remember, Med Surg Moments is a moment in our lives, a moment in our Med Surg careers that makes a huge difference.